Hi everyone, so I'm just going to do a quick recap of all the clinical sites and experiences I had. So my first one was Children's and Peds, so I went to a children's hospital. I was there for 6 days, so do 2 days a week, not much going on. I passed out like 1 or 2 medications on my second day. Some of the nurses were mean because they don't want us to follow them, so we sat on the computer, but we were able to see doctors and pharmacists and other healthcare providers, discuss and work with kids and work with the kids' family members and stuff like that. I didn't really learn much from my children's peds experience. And then after that, I had Detox, which was 2 days. We went to a detox center, super laid back. The director gave us a tour of the facility. It was a really small facility. We did vitals. We did rounding. We helped with pass out food when it's dinner time. We played games with the residents, and that's it. We didn't give medications because there was only one nurse, and she's the only one that gives out medications. Our instructor was with us. And then after that, I had my OB that was 2 days a week, and for 2 weeks, so it was 4 rotations. I was in labor and delivery the first day, and then the nurse that I was with, she was training another new nurse, so then my instructor pulled me out and put me in postpartum with a nurse. She had 20 years of telemetry and cardiac experience, and then it was 6 months of experience for postpartum. She was good. She explained everything to me. I didn't do a lot of hands-on experience. I didn't really give a lot of medications, but I watched her as she did her newborn assessment, maternity assessment, gave out medication, breastfeeding education, and all of that. Third day, I was in postpartum again with another nurse. This time I was able to pass out medications. Mostly was oral medications. I helped out with newborn assessment, maternity assessment, felt the fundus and all of that. Fourth day, I was in labor and delivery. My patient was in labor, but she wasn't dilating, so I wasn't doing much. I just sat around while my nurse would check the cervix. The doctor would come in and check on the mother. And then when my shift was about to end around 9 p.m., my instructor found another patient who's going through C-section, who's going to have a C-section. So I went and I saw it, and I was in the operator room for like about an hour, and I saw the surgeon, I saw the circulatory nurse, the labor nurse, the NICU because the baby was premature, the doula, the patient, her significant other, and stuff like that. It was really good. It was wonderful. I loved it. And then that's all. And then after that, I had a mental health rotation, which was 2 days for 3 weeks. So it was a 6 rotation. We went to a level 1 trauma hospital, which had a mental health facility. Wonderful instructor. He taught us how to chart. So we charted on patients. We had like one patient for the first 2 weeks, so I started to get to know my patient very well. I passed out medication, so I passed out a narcotic, so she had a Suboxone. And then my last day, I passed out some medications for another patient who had like 3 or 4 medications. All of them were oral, but it was nice to see how to go through the epic and give out medications and stuff like that. Not much going on in mental health. You just do vitals, you do rounding every 15 minutes, and you check on the patient, you talk to the patient, you help pass out food for the patient, you hang out with the patient, you do your charting and everything. Wonderful. Enjoyed it. And that's all. Those are the experiences I've had with all my clinicals. Oh, I also did have med surg. That was last year, spring of 2020. I had med surg, and that one was 6 days as well. And that one is where I also passed out medications. I helped out with cleaning up the patient. I gave IV, like I think I gave a heparin drip. I gave I helped with a suppository medication, and then I also watched a nurse clean up a wound and then wrap it back up. So those are all. And then now I have one more clinical, and that starts in August, and that's going to be my practicum. I'm going to be in the cardiac ICUs. I'll be by myself. I won't be with my instructor or my other classmates, and I'm excited for that. I hope I get to do a lot more medication administration, learning how to operate the IV pumps and stuff like that, and just caring for the patient and doing everything else with the patient. I still work as a PCA. I went down to from 0.6 to 0.5, and I still work evenings and nights, and I've learned so much on my unit, and all the patients that I get, they're the older population, so they're like from 50 years old to like 80 to 90, and then everything that you're learning in med surg, the disorders, you actually see the patient with it, so it's kind of cool. Yeah, that's all of all the clinicals I've had in my program. I'm almost done. I have one more semester, and that's it. Thank you. I'll see you guys on my next video.